Hi friends, the most common surgery we perform at eyesolutions is cataract surgery, and as surgeons we impose a lot of do's and don'ts post the surgery. Of course we give you everything in detail in writing, but we wanted to make a video to help you at home post the surgery, or even help somebody who is taking care of you at home, so that if you ever wonder what has to be done, you can quickly look at the video and it will relieve anxiety. So here are 8 points that you should remember after getting cataract surgery. The first is that you cannot scratch, itch or rub your eyes. No touching the eye at all. Point number 2, you cannot take a head bath for 12 days after the surgery. You can take a bath below the neck, but no water can go in the eye. Point number 3 is no bending down, no straining or no lifting heavy weights. By straining I mean, for example, if you are constipated, you do not strain. You should inform us and we would give you some medications to help you with that. Point number 4 is we have given you these glasses. I have a sample here for you to see. These glasses all of you have in your bag, and you may have noticed that these glasses are bent on the sides. They tend to cover this part of the face, which will reduce the dust and the wind from entering your eye. Sometimes people do find them a little uncomfortable, and if that happens, it's okay if you don't wear them at home, but we would strongly suggest you to wear them if you were to step out of the house. The 5th point is to use the cup that we give you at night. Here is the cup and some micropore tape, and what we want you to do is to use this cup over your eye like this, put some tape across the cup. We do not want you to put cotton or gauze under the cup. The reason we use this cup is to prevent you from inadvertently poking your eye or scratching your eye while you are sleeping. Next comes the eye drops. We have given you 3 eye drops that you have to use after the surgery. The first is a steroid. One brand is Predfort. We want you to use these for 1 month after surgery. The first week after surgery you would use them for 6 times a day. The second week you will use them for 4 times a day. The third week you will use them for 2 times a day, and the 4th week you will use Predfort eye drops once a day. After that, these eye drops will stop. We expect you to shake the bottle well before using the drops. The second eye drop that we want you to use is an antibiotic. It is some brand of the medicine moxifloxacin, and we want you to use this drop 6 times a day for 2 weeks and then stop using the drop. And finally, the third drop is a brand called Nevanac. Another brand of a similar medication is Nepaflam. We want you to use these drops twice a day for a month and then stop. There will be times in the day when you want to use all 3 one after the other, and you can do that with a 5 minutes gap between each of the drops. The 7th point that you should remember is that every day after cataract surgery you should notice an improvement in your overall condition. Your vision should improve, your redness should decrease, pain should decrease, irritation should decrease. If you ever feel that something is not going right, we would request you to call us up immediately, and we most likely will call you to the hospital immediately to have a look at you. What we are looking for is a post-operative infection, which is one of the most dreaded complications of cataract surgery. And the last point, the 8th point, is that you will do a final checkup 3 weeks after surgery. And this checkup, in this checkup, what we will do is we will look for your glass number if you have glasses. We of course aim for you to not have glasses for distance when you put a monofocal lens inside your eye, but there is always a chance that you may get a 0.5 number, and we want to check that number 3 weeks after surgery to finally give you a prescription which you can go ahead and make your glasses and then see the world much better than you have seen before. So take care of your eyes post surgery. Thank you.